It is nothing short of a scientific miracle that we can today test your newborn's hearing simply one day after birth. Within a few hours of birth, we are able to determine that the child can hear well, saving your child from any future difficulties in language, social, academic, and lifelong learning. You heard me. Autoacoustic emissions, called OAE for short, are a gold standard for screening your newborn's hearing, available globally, and you are able to judge within 1 minute of a very painless, gentle test, a test in which we give tiny sounds in the baby's ear canal and collect an echo from the inner ear. Absolutely non-invasive, simple, and quickly effective. One can know if the child can hear well or not. Maybe 10% of the babies will fail the autoacoustic emission test on the first try. Don't panic. We will repeat it after 2 weeks. If yet we find that the baby fails this screening, we would want to rule out a middle ear fluid or any other foreign body in the ear canal. Further to that, we may need to do deeper investigations like the ABR or the BERA, which is the brainstem evoked response audiometry, to be completely sure that the baby is hearing fine. Always get your baby's hearing checked, because today you can. This is really a blessing. It has saved so many children from passing beyond the 3-month age and not knowing about their hearing levels. Once we know that a baby has a hearing problem, we can immediately take action, give them hearing aids, cochlear implants, or as necessary, ensuring that the baby will not have any hearing and language gap and will live a fuller, happier, functional life.